Hi, everyone. Thanks so much for being here. Thanks for your presentation, Rika. Wonderful. Um, so, as Marielle said, I worked for my 2020 biomedical and health informatics internship. I worked at the UNC Connected Health for Applications and Interventions, or the UNC CHI Core. CHI Core is an organization that does web design and development, as well as systems analysis, app development, graphic design, database development, and usability testing for various public health research projects and initiatives. Basically, they just help get different public health internships off the ground from all sorts of perspectives. CHI-Core primarily works locally with the UNC Lineberger Comprehensive Cancer Center and the Nutrition Obesity Research Center, among others. This group has its hands full with 7 full-time staff working on dozens of projects. Web and app technology are now an integral part of public health education, and using best practices in web development, health data structure and accessibility. CHI creates platforms for improving public health in North Carolina. Primarily, I worked on the Chatham County Food Hub project, and once we were finished, I participated in various other projects and gained some practical experience with project management, testing, HTML and CSS development, digital accessibility best practices, and database management. CHI-Core does an extremely important job, in that it builds the structure for an interface for digital public health initiatives and research projects. These projects are often targeted at minority groups and economically disadvantaged people. Their meticulous and thoughtful design is really crucial to increase usage and overall impact of these projects. My experience was really exciting and I think valuable to learn some of these skills and contribute to this important work that could help many people in both the short and long term. So the Chatham Food Hub was the main project I assisted with. I led the management of this project from the early stages of development to implementation. The idea for the Chatham County Food Hub came from another online food hub that started in the Triangle called Carver United. The goal of the food hub is threefold: to boost revenue for local businesses, provide a safe space for Chatham County residents to pick up pre-prepared, locally made food distributed with local COVID-19 safety standards, and to provide a path for Chatham County residents in need to pick up free food boxes supplied by a local food pantry. So essentially, the Chatham Food Hub is an online kind of ordering platform where several local restaurants can put limited menus that Chatham residents can order and pick up on a weekly basis to have pre-prepared food without having to, go to a restaurant and be able to feel safe about helping support the local economy. My role was to test various platforms by which to implement the online food hub, design a system to update the weekly menu in 2 locations, design the food hub website, and help maintain the website throughout the implementation. I managed requirements from multiple stakeholders in this project and had to keep flexible and efficient communication to ensure all parties were up to date on project progress. The first step was to choose a platform to host the online ordering, which surprisingly took extensive research and discussions and testing to decide the best platform. The biggest concerns were cost, usability, and functionality. From there, we had to design an efficient workflow for this project. One of the major breakdowns in the Carver United system was the inefficiency in the menu building process. The curator of the menu would have to individually contact each vendor and ask for their weekly menu. They would then fill out a spreadsheet each week to upload it to the Toast menu template. I decided to help streamline the process by making a survey whose results output to a spreadsheet, which is in the same format as the Toast template. I'm sorry, Toast is the name of the the online ordering platform. And I also set up a separate Chatham Food Hub website so that this result should be directly uploaded into the website to display the menu without further manipulation. I tested and iterated the survey with vendors to ensure that it was usable and efficient. This helped save some time for the employee by the Chatham County Health Alliance to make sure that they didn't have to spend extra hours and waste valuable resources uploading the food menu, and were able to do it much more simply. Once the platform was chosen and the workflow was planned, I designed the Food Hub section of the website. I used skills I learned of user interface design to plan the most user-friendly and efficient website page possible, taking into consideration mobile devices as well as non-English speaking users. At this point, I worked with Chai's graphic designer to ensure all digital accessibility standards were met. I then used the Chatham Health Alliance's chosen website platform to implement the design. I would not be staying on for the duration of the project, so I wrote a detailed training document for the website coordinator on how to update the website and communicate with the vendors. And here you can see the wireframes I used to design both the process of uploading the menu and the wireframe for the website. It was really rewarding to see a project through from beginning to end and track its success over time. Over the course of the Food Hub existence, it's generated almost $8,000 in revenues for local restaurants and farms. It paid out over $7,000 in wages to Chatham County residents, donated 862 servings of prepared food to hungry Chatham County residents via the local partners, the Chatham County Health Department, Chatham Housing Initiatives, communities in schools of Chatham County, and the Salvation Army of Chatham County. It distributed 220 Cora food boxes, which was the free food box that was available to hungry residents. Distributed 300 free cloth face coverings to Hub customers, again, to help limit the spread of COVID-19, and hosted the Chatham Health Alliance Resource Hub, which was a team to provide COVID-19 testing information, personal protective equipment, medication disposal kits, and school supplies, among other resources to Food Hub customers. So this was a really great experience to get to work on this, again, from start to finish, and I really enjoyed it. The next project that I worked on is called Health Score. Health Score is a 6-month-long research program for cancer patients and survivors at UNC. The goal is to provide health coaching, health monitoring, and fitness tracking, among other resources for this population. My role with Health Score was to test the website for bugs and errors so that their developer could have a functioning build iteration for the client. I also learned a lot about the complex nature of data storage for users in this system. Data is stored in 3 places for this website: the UNC Procore database for survey data, the Fitbit website for activity tracking data, and Epic, the electronic medical record for patient health information. HealthScore uses server-to-server APIs to pull data from the website for each location, which are stored in a MySQL database and using PHP. This is one of the more complex projects in terms of data storage and retrieval, as it comes from 3 separate storage locations. I learned the process of writing code for the user interface for data input, writing basic templates for data flow using PHP, for storing new user registration, and syncing and pulling information from the Fitbit website to the patient portals. Users of the system are one of 3 categories: patients, healthcare providers, and health coaches. The system security was an important aspect as it stores patient health information. Patients register themselves in the system and fill out weekly surveys about their health and activity status. coaches and providers are restricted to seeing only data from the patients that they coach or treat, and patients can only see their own data and communicate with their coach or provider. It was vital to use an encrypted browser and design and maintain or use robust relational mapping in order to maintain a properly structured database in order for users of various roles to see only the information that they are permitted to view. This was a really interesting project to get to work with, and I learned a lot about the and assisted with the very technical aspect of health data storage and how to design workflows for both user interface as well as backend data storage. The next project that I worked on was called, which was originally titled Process, as you can see in this image above. It is a research project that provides an online portal of information, tailored advice, and peer connection for recent ostomy patients and caregivers. Ostomy surgery changes the way that urine and stool exits your body, and patients who go through such an invasive surgery often need support, guidance, and recommendations for how to best adjust to their new situation. Prisms is a platform for both patients and caregivers, which connects them to frequently asked questions, an advice nurse, peer support, and even tracking their activity levels as well as water consumption to help improve their quality of life. I was responsible for writing the HTML and updating the CSS for certain sections of the website. As is the case with some projects, the original content from the researchers that was given to our development team was in a difficult format, as it was exported HTML from a Microsoft Publisher file, and therefore it was very messy and it needed to be rewritten. Here you can see on the right the end results of one of the sections that I wrote. I had to append the CSS files to match the prescribed design features for the website to make sure that everything was uniform, and including these accordion boxes and text, font, and color. Near the end of my internship, I was also involved in the production of an introductory video for Prisms. While the act of storyboarding and editing a video is only tangentially related to public health, I was able to learn about important design factors that go into educating certain populations, including text size, color selection, and plain language and audio standards to account for the elderly population that was most likely to use the website. Next project that I worked with was called RISE. RISE is a public health intervention platform for the study titled Using Behavioral Economics Strategies to Address Obesity in Economically Disadvantaged Adults. 85% of economically disadvantaged adults are overweight and obese, and therefore at a significantly higher risk of various related health conditions. The project will take place over 12 months and includes weekly goals for weight loss, calorie intake, and physical activity minutes, as well as tailored feedback, weekly lessons, and healthy recipes. Research shows that there is less reinforcement for healthy behaviors in this population, and therefore a program with extended period of healthy reinforcement could be effective in achieving weight loss and better outcomes for this target population. RISE, as I said, measures weight loss, calorie intake, and activity level, and is able to give resources and targeted feedback based on their weekly outcomes. I was responsible for parsing through the original content files that were given to us by the researchers and converting it into plain text in order to write it into the HTML of the website. In addition, I cleaned the text, removed images and any symbols that could not be read by a text reader that were given to us in the original content files. This is another example of the accessibility standards that I learned were necessary to adhere to so that all people have access to these health resources. Lastly, I quality control checked the content of the weekly automated feedback to ensure it matched the weight loss, calorie intake, and activity level conditions. Next, I'll talk about Popsim. or Population Simulation for Healthcare Decisions, which is a sub-project for the Cancer Prevention and Control Research Network. This website will include interactive database interface for users to see how cancer screening rates are affected by group variables. It's different from many of the other projects in that it primarily is provider-facing rather than patient-facing. I was initially slated to help with data integration, analysis, and display on the website. I took a online practice in R and spent time practicing with this sample data from this population. However, because of other deadlines, Popsim was deprioritized during my time at CHI, and I didn't get to work on the final project. However, I'm grateful that I did get to learn more about R and get to experiment with some of the sample data. But unfortunately, I didn't get to work too much on this because of other priorities. The last project that I worked on was called Dynamo Kids, which is a web-based pilot to test to encourage obese children to lose weight and develop healthier habits. The website is intended to be used by parents or guardians to help educate them on how to best make appropriate changes to child behavior in 3 core topics: physical activity, sugar sweetened beverage consumption, and nutrition. In this project, I was responsible for testing various iterations of the site to ensure that it met client needs at each stage of the build. I also participated in several sessions of user testing interviews of the site, which was really informative to understand how user testing is done and what they prioritize in learning more about what's important for these populations and what will be important for the final iteration of the website. Another thing I'd like to talk about is digital accessibility. I've touched on this already, but CHI was very cognizant of digital accessibility standards. These included plain language, meaning that the content included for these projects aimed at the public had to be clear and understandable for all people. This means keeping simple sentences, writing for the lowest level readers, and using bullet points rather than paragraphs of text. Again, some of this is pretty self-explanatory, but it is really important to include because it makes these initiatives actually work for the populations that they're looking for. And given that the researchers behind this are very intelligent people, they tend to write with jargon or a little bit more scientifically, which can be difficult to understand. So we were in charge of helping them tailor content with these standards in mind. Next are accessible colors, meaning that the colors in text and logos must have appropriate contrast in order to be legible for colorblind or visually impaired people. Also, text and closed captioning is important for hearing impaired people in videos. Lastly, all content must be designed to be compatible for screen readers so that blind or visually impaired people can access the content. These are really important standards, I think, and help close the gap between people who have disabilities and disadvantages, as they can often be left behind in these settings. And so these were some of the accessibility standards we're looking into. There is a plain language thesaurus that helps tailor the content to different levels of populations to make it more understandable for all people. And this graphic on the right is design kind of recommendations for people on the autism spectrum, but it is also just kind of good practice for all design and people to, use more simple colors that have appropriate contrast, writing in plain language, using simple sentences, and making consistent layouts for websites. So I really enjoyed my time working at CHI, but there were a few challenges to have to work through. As everyone who's been working during COVID-19, we had to work remotely. this made it difficult to acclimate to at first. Working in new environments, it's critical for short-term positions like this to really be able to adjust to the people that you're working with and the situation that you're working in. It was more difficult than in typical scenarios to ask questions, plan, and coordinate. However, as we all have, we've gotten very comfortable with Zoom, and we're able to adjust to work collaboratively. And I think I still had a successful internship. It was also a challenge not to be able to work on certain projects, as I mentioned, Popsim, due to the changing priorities at Chi-Core. I think that would have been a really excellent learning opportunity for me to get to implement some of that data analysis and integration onto the website using R. But I was able to shift to take on more roles in different projects, and which gave me a wide range of experiences in different types of public health initiatives. And lastly, I had to do several online tutorials to catch up on various aspects of the work that we did, including using R, HTML, and CSS. It was challenging to balance the work that needed to be done and learning independently to properly execute the tasks at hand. But ultimately, I think it was a good thing, and I gained more in-depth knowledge of those topics, which will help me in the future. One of the prominent aspects of what I learned about was project management and how to best coordinate and communicate with the groups and individual stakeholders working on the same project. Chai used weekly sprints to target tasks, and their project managers were very skilled at breaking down large deliverables into manageable and targeted tasks. This is a really valuable skill that I'll take with me into my future career. These breakdowns were not only helpful to keep projects on task, but also, were even more helpful in our remote working environment. I spent time writing HTML code and learning CSS, which was very interesting, and it allows me to, not only put content into websites, but better execute, appropriate and user-friendly design to elements to make web browsing as easy and efficient as possible. Additionally, I did learn theory and basics of how to use R, even though I didn't get to use those skills in practice, again, due to Chai's changing priorities. Overall, I think that my internship was valuable in that I learned many skills and gained connections from my time working with the Chi-Core group. And I hope to use these skills that I practice as I move forward into my career. So I just wanted to take a second to acknowledge some of the people that helped me through this. Dr. David Gotts was my academic advisor through my time in the BMHI program. And I'd also like to thank Marielle Ruiz for her assistance in coordinating me with this internship. And lastly, I'd like to thank Katie Tippy and Jennifer Wills Gallagher for their guidance as my mentors at Chi. I'd be happy to take any questions if you have them.